Schistosomiasis, bilharziasis, is an acute and chronic disease caused by blood flukes, trematode worms, of the genus Schistosoma classification, kingdom Animalia phylum, Platyhelminthes, class Trematoda subclass, Digenea family Schistosomatidae, subfamily Schistosomatinae, genus Schistosoma species S. mansoni, S. japonicum, S. hematobium, S. mekongi. Mode of transmission: people become infected when larval forms of the parasite, released by freshwater snails, penetrate the skin during contact with infested water. Some of these eggs are passed out of the body in urine or stool, but others can get trapped in the body's tissues, which leads to an immune reaction and, unfortunately, damage to organs. There are different types of schistosomiasis, and each type is caused by a different species of schistosoma worm. The most common species that infect humans are Schistosoma hematobium, Schistosoma mansoni, and Schistosoma japonicum. These worms can live for many years in the body, causing long-term health problems. Schistosomiasis is really a disease of poverty. In 2021, 251.4 million people needed preventive treatment. Only 75.3 million were treated. It's especially common in parts of Africa, South America, the Caribbean, the Middle East, and Southeast Asia. People who live in poor rural communities are most at risk, mainly because they often lack access to clean water and proper sanitation. They might bathe, wash clothes, or fish in water that's contaminated with schistosome larvae. Children are especially vulnerable to infection, since they're more likely to play in contaminated water. Schistosomiasis is spread through contact with contaminated fresh water. The life cycle 1. Eggs hatch in water and release miracidia. In the water, the eggs hatch and release larvae called miracidia. These miracidia then infect specific types of freshwater snails. 1. Inside snails, they develop into sporocysts, producing cercariae. 1. Inside humans, they lose tails and become schistosomuli. 1. Mature worms exit the liver via the portal vein system. Symptoms and impact. One early sign can be a rash or itchy skin where the parasite entered the body. Later on, fever, chills, cough, and muscle aches might develop. Schistosoma hematobium infection often causes blood in the urine. If the infection lasts a long time, it can lead to damage to the bladder, kidneys, liver, and intestines. Diagnosis. The presence of schistosome eggs confirms the diagnosis. It's really important to handle these samples carefully, using gloves and protective equipment. Treatments. Early diagnosis and treatment with medication can prevent serious complications. Prevention focuses on improving sanitation, providing clean water sources, and reducing contact with contaminants.